Namaste, guys. I am Dr. Anushruti and I'm back with an amazing episode. Today's episode will witness a lot of things that are necessary and actually makes a physical therapist professional by work and by all the corners. So, to share his thoughts today on board, I have Dr. Shaun, who helps rehab clinicians in improving their clinical skills and make money by treating patients. So, let's not waste time and directly speak to him. Hello, Dr. Shaun, how are you?
I'm doing well. Thank you for having me.
Thank you so much. Well, you are so much into making the clinical rehabs perfect. So why not to ask the very first question that what are some qualities that you feel make a professional physical therapist?
Yeah, that is a great question. For me, the biggest thing is to remember that as a physical therapist, that you are working with other human beings and other people, right? They're potentially at a very vulnerable time in their lives. So when I think about what makes a great physical therapist, I think that empathy and being empathetic and developing a personal relationship with your patients and potential patients, that's always step one for me, and that's a lot of what we talk about and teach in our mentorship program. The other thing is, and you see this a lot on social media and even with new grads, is that you have an ego, a bit of an ego, right? In the US, at least, you have a doctor in front of your name. You're a doctor of physical therapy. And the reality is that as a physical therapist, as I see it, is that you are a guide for a person in their process. They come to see you with pain, and you are the person who is going to help guide that journey for them. And one thing that we teach a lot is patient-centered care. And if you truly believe in patient-centered care, then you really need to put the ego aside and put your beliefs aside and truly seek to understand the individual that you're working with, the person who's in front of you, what their fears are, their concerns, what their learning style is, what their goals are, and how you can provide clarity to this person about their journey and the process that they are going to take in a way that they understand. The other thing I would say that in terms of a quality that makes a great physical therapist is staying curious. And this is something that we talk a lot about in our mentorship program as well, is we talk about ego and growth mindset. And one of the biggest traps that we can all fall into as physical therapists and humans, I would say in general, is thinking that you have everything figured out, because the reality is nobody does. And the minute that we start thinking that we have something figured out, we're probably missing out on a huge opportunity to help more people, because it's an area or gap in our knowledge. And the last thing, this is a subject I think a lot about, so I got a lot of answers on this one. It's kind of
Well,
related to what I just
yeah.
said. Oh, no, go ahead.
I believe, we can just state n number of qualities, and most of that, the above thing, the top of the thing is to be a human being first. Do
Human
not forget
first.
that you are a human too. So, next question, moving on, Dr. Shaun, what should be, a physical therapist's approach towards treating patients, be it chronic injury or acute injury? What should be their first and basic approach towards that?
Yeah, sure thing. So first thing, so I kind of approach every situation the same with little nuance depending on if it's acute or chronic from like an injury perspective. The main thing again is human first, right? It's the first tier would be I call it education or like psychology, but understanding the person who is in front of you, the things that they're afraid of, the things they're worried about, the concerns they have, all of these things, any maladaptive beliefs that they might have from other medical professionals, things that might impede their actual rehab. From there, it moves to range of motion. Do they have the mobility necessary to do the things that they're trying to do? Then do they have the strength? Then do they have the capacity? The biggest difference between acute and chronic is that with an acute injury or like a post-op or surgery is that that's going to become the thing that we have to be most mindful of, because the tissue needs to heal. So we need to promote an environment that's going to let the body heal. Versus something that's more chronic, where like the educational side of things or the psychological side might be more of the barrier to entry to helping the person.
Okay. Why do you think, Dr. Shaun, that there is somewhere or sometimes in either parts of the world, second-hand treatment with physical therapists or with the profession of physical therapy? Why is there, this discrimination prevailing in the field of healthcare? I believe everyone is a doctor and
Mhm.
be it of any kind of healthcare, any part of healthcare. But why do we still see as MBBS doctors, MD doctors over a top palette and physical therapists? Like, we even, some people do not even know, they often tell them as yoga instructor, massage therapist. So why is it prevailing so much?
Yeah, that's another great question. I don't know if I have the answer to that one, but it's funny. Like whenever like someone sees an email from me, they'll see my email signature and it says Dr. Shaun Astorga, and they're like, "Oh, you're a doctor? I didn't know you were a doctor." Yeah, I think that just in general, right? Like over time, that doctors, lawyers, like certain professions, just have a certain association with them. So the perception is that they are, that they kind of have everything figured out, that they're the top of the hierarchy and all of these things. And the way that I view like physical therapy and helping a person is that is a team approach, right? So everyone really needs to be working together. Why physical therapists aren't always treated in that way. Part of it might be that perception. Part of it might be that our field is, well, it's not a newer field. The doctor aspect of the field, at least in the U.S., is newer, and I think people are getting more and more kind of comfortable with like the terminology. But what I would say is something that we do a lot. Our practice is set up a lot differently than other typical physical therapy practices. Is we kind of take a lead approach in developing that team and that network. So we have surgeons that we work with, we have orthopedic doctors we work with, we have fitness professionals, yoga instructors that are kind of in our circle. So when a person comes to us, we can really focus on them as the center of the care, right? It's like their story, if you will, and we are able to supply them or provide them with referrals to appropriate people. We still get the situation where like, oh, my surgeon told me this, and this is what I'm going to do, and we're like, okay, but as long as you're developing the relationship with the person, you have a window and you have a chance to help them, because now you have an opening, you have a relationship, they trust you, so you can kind of move forward in that capacity. So I don't know if I have a true answer for the first question, but
It does. It does. As we say, work together, grow together.
work
Like,
together, grow
moving on,
together.
Dr. Sean, I would like to introduce you to one of the favorite segments of my show where we answer the question of my followers, patients, and clients. So, I have a bunch of questions ready for you directly from those people. So, are you ready to answer the question?
Yeah, let's do it.
Okay, so the first question comes from Varsha Gupta from New Delhi. New Delhi is the capital of India. She says, "Hello, Dr. Sean, how are you? I am in my final year, but I get tensed when a patient comes to me. I get confused and forget everything that I know or what I can do. Please help me out in this."
Yeah. So I've been practicing for a while. That still happens to me. So I would say the first thing is, again, this is kind of the theme I think for today, is remember that you're talking to a person. And if you like make it weird, it's going to be weird. So if you just ask a lot of questions, get to know the situation, right? Understand the person in front of you. They're essentially going to tell you what the issue is, right? You just have to get good at asking questions. So we always talk about asking why a lot. So when someone tells you something, ask them why. You keep asking more and more where you can get deeper into the conversation. And then from there, I would just say take a breath and figure out what is the likely thing that is limiting them or causing pain or limiting them from a certain level of function, because that's going to give you an idea of where to start. That would be the biggest thing. And take a breath,
Okay.
exhale.
Nervousness is, like a part of journey. And if you are
Yeah.
getting nervous, that means that you are still working on you, and that is a positive sign in a way.
Of course, yeah, and it's really just once you have a relationship develop with a person, you don't have to figure it out on day one, right? They're going to be working with you over time, so you have an opportunity. You might think of things after the fact, and as you develop your career and your skill set, right, these things are going to pattern recognition develop, so things happen quicker. But in the beginning, this is normal. It's something that we're all going to go through, for to some extent.
Okay, moving on, we have Shikha Saxena from Jabalpur. She says, "Why do I get confusing doubts as in should I continue this career or not? Should I switch to another career? What should I do? Please help."
Oh, that's a big one. Yeah, so I guess the big thing in this regard is understand, like, define what your goal is. Why did you want to become a physical therapist? Because once you have the defined goal, the actions you take now, right, they can be in line with the goal or they can take you away from the goal. So when you understand the underlying reason, and you have a defined situation, right, that gives you a little bit of clarity versus just saying, I want to be a physical therapist and not really having a deeper why to the situation. So developing that is usually a helpful first step.
I believe, it is fascinating for students out there to be a doctor in life. And when they are into the studies of doctor of physical therapy, when they see the syllabus, the anatomy, biomechanics, and exercise therapy, all that modalities, everything, they just feel like giving it up on it. They do not have the courage to move ahead with it. And even if, when I was there, I have personally come across so many students who just came into this field for the doctor tag.
Mm. Yeah, no, that's true. And like even having the courage to finish, right? If you have the deeper why, the deeper meaning behind why you want, like being a doctor of physical therapy to me isn't a strong enough why. That is just a title, right? So if you like are, I think about a patient who has an injury, right? Like it's not really like the shoulder pain that is the problem. There's a deeper reason to them why that is problematic and they're seeking help now. We need those things in life in general, right? Is to have a deeper meaning to the things that we're doing, because then is going to guide the actions that we take. That's where your courage to finish is going to come from. A lot of times too with doubt, right? It's because of fear of uncertainty in the future. So to your point, right? It's having the courage to finish, and oftentimes like the most growth for us as humans is going to come from those periods where things are difficult and our brain and everything is telling us to stop. It's like when we overcome that, right, we are able to grow to the next point where our brain's going to tell us the same thing. So then it's just a process of continuing to get through that.
Absolutely. Well, moving on, we have Varun Verma from Agra. He says, my patients do not have patience. Okay. My patients do not have patience in them. Sometimes they leave the treatment from me. They do not get their treatment done from me till the end because they want quick recovery, and I do not know how to convince them.
Yeah. Yeah. There's a couple of different things I think in this. One is understanding like what your like business or clinic, how it's set up. So if your promise is that you're going to get them quick results, then yes, you need to get them quick results. If your promise is that you're going to get them like there's a long-term plan where they get back to doing whatever the activity is, then that's a different perspective for the patient coming in. But it really also comes down to how we as the professional are communicating the process to a patient. So when we talk about process with a new patient, our promise to them is that we are going to help you get back to playing basketball after an ACL repair. We're going to help you get back to playing with your child after hurting your shoulder, whatever it might be. And then when we are talking to them, we can lay it out in 3 phases. So phase 1 is we're going to help you get out of pain. Phase 2 is we are going to help you develop the strength in your tissue, right? Phase 3 is it's going to be very specific. Now we're going to be doing the activities that look like basketball, for example. So from the first day of their treatment, we are already setting the stage for a journey. And we're giving them clarity on the process. This is what you can expect. This is how many sessions I would anticipate that this is going to be, things along those lines, so that they, at least from the beginning, we are already putting these thoughts in the patient's mind. This is very different if you go to like a PT where they're like, we're going to get you out of pain really quick, 3 sessions, and then that's it. That's a very different conversation. But as long as the patient understands the process, I think that'll be helpful.
Well, bingo, you have answered all the questions of the patients and clients. And moving on, I still have a lot of questions with me for you. So,
Sure.
the another question coming up on your way. Do you feel that it is very necessary for people to understand their body anatomy? Just in case to treat them better and to know the importance of health and fitness?
Yes and no. It depends on what we're talking about. In general, to understand like health and fitness, I think there's a lot of misconceptions in the information that is put out to the general public. So being able to help a person understand and navigate that process, I think, is 100% necessary. I think that giving people like when people have pain, for example, right, they have a sense of maybe losing control of their body or not having control over the situation. So the locus of control for them is very external, and they think that we need to do something to them to help them get better, when the reality is we probably just need to set them up for success so that they can, heal on their own. And when a person's out of touch with their body and they're afraid to move, our goal is to always uh, give them that confidence back, and with that comes an understanding of things that are okay to do and not okay to do in terms of like pain, right, in their situation. Giving them those kind of guidelines so that they can take ownership over the situation. For some people, this does involve understanding some of like the underlying, they like to understand like the anatomy and like why we're doing every single thing to like the nitty gritty detail. That's just really a personality type for them. For others, it might be more general, and we can just kind of relate an exercise to maybe their goal or something along those lines. But I think it's important that people at least have some baseline understanding of what is acceptable, like that's going to allow them to heal, and what is, probably going to be detrimental, because then they can take some control over the situation.
Well, last but not the least, what is Dr. Shaun's biggest piece of advice for the next generation of physical therapists coming up on the way?
Oh yeah, that's a good one. The biggest thing, I mean, is, and again, it's come up a lot on our talk today, is remember that we are working with humans, and as such, we don't have to be a psychologist, but we have to understand that a lot of emotions are involved, that a lot of different learning styles are involved, and when in doubt, right, always remembering that will help the rest of the process out, because it's not a transactional relationship, right? It's not like you give me money and then I make you feel better. It's like we have a relationship here that we are developing. And if you approach things from that perspective, it tends to go a pretty long way. Second piece of advice would be to find mentors who are doing what you want to do and learn from them. Work with them, stick with them, because it gets very lonely treating as a physical therapist if you
Mentors
don't
like
have that.
Dr. Shaun.
Yeah, I mean, that would be ideal, but yeah, anyone who's like in your area, right, that you could work with. We do a lot of remote stuff, but it's very helpful. And in the US, it's a big issue, is that a lot of jobs promise mentorship, and then you start working with them and you never get the mentorship. You're still looking for it, right? So finding those people, it will take you a very long way.
Okay, with this, we have come to an end of the episode. But at the end, I would like to make a note that you guys are really doing a great job. And I know this time would be hard for you, this time would be challenging for you. But remember that good things, they do take time. So give the best out of yourself, and trust me, that is all going to be worth at the end. Well, thank you so much, Dr. Shaun, for joining in, and I believe you enjoyed it as much as we enjoyed listening to you.
Thank you very much for having me.
Thank you so much. And here is the reminder from Dr. Shaun, me, and the skeleton behind him to straighten your back, have a glass of water, and move. We'll meet in the next episode. Till then, goodbye. Take care.
All right. Thank you.